If you do not get health insurance from an employer or you are losing employer-based coverage and you want health insurance, I'm going to go over the options that are currently the strongest and what I recommend to my clients. So, usually people who come to me are in one of these few situations. They're either quitting their job to start their own business, or they have lost their job and they need some sort of bridge coverage until they find another job, or they are an early retiree and just need something for those few years until they reach age 65 when they can get Medicare, or someone who has a spouse in one of those situations. So let's go through the options. There are three main categories of coverage that I usually recommend. We'll go through them from most comprehensive coverage-wise to least comprehensive. So the first is ACA marketplace coverage. This is a federally regulated and facilitated marketplace. Some states have their own version of it, but it's the same thing, has the same plans. So that's the most comprehensive. There are government subsidies available to bring the cost down if you qualify, and that's mostly based on income. The second option is short-term medical. Now, short-term can be a little bit of a misnomer because you can buy these plans usually for up to 3 years at a time, but good option for a lower premium if you do not qualify for subsidies. There is underwriting involved, a couple other limitations. We'll go into that in a second. The third option is medical cost sharing. So this is not insurance. This is like a community that comes together and pools money to share in each other's medical expenses. Not for everybody, but it's becoming a viable option, and I now recommend it for some people. So we'll go into a little bit more detail on each. The first, ACA marketplace plans. So every plan on the marketplace has to adhere to the Affordable Care Act regulations or specifications for qualified health insurance. So in a nutshell, that means it covers pre-existing conditions. There are no benefit maximums. It needs to cover preventive care, at least the office visit for preventive care. There's no underwriting. So if you are enrolling within an enrollment window, then you can jump into a plan, no questions asked. And subsidies may be available based on your income. So some limitations to these plans. There's some things to think about. This is getting expensive, especially if you make too much money to qualify for subsidies. So you may want to look elsewhere and trade off a little bit of that baseline protection of coverage that the government sets forth, like no pre-existing condition limitation. The enrollment periods are fairly limited, so you have to enroll during the open enrollment period, which is in the fall of every year, or if you have a qualifying life event, you can jump into a plan mid-year. So usually, like if you're losing employer-based health coverage, if you are moving to an area where your plan is no longer serviced, some basic life change, things like that, the birth of a kid, a marriage, a divorce. So the one other drawback of these plans, and it's not really something we can do much about, is the networks. So you're going to need to stay to a local network. These plans, I haven't seen one really that has like a comprehensive national network where you can go anywhere in the country. You need to stay close to home. If you live in a big metro area, that's not really a big deal, but just be aware of that. And you want to make sure that all of your must-have doctors, hospitals, facilities are in the network of the plan that you're choosing from, that you are choosing, excuse me. That is the most important thing to consider with one of these plans. So that's a good fit for somebody who uses a lot of healthcare, has expensive medications, is undergoing treatment for something. That is your safe bet. If that describes you, then this is worth the extra cost that it may be to you and some of the limitations that these plans do have. As far as protection goes, as far as coverage goes, this is as comprehensive as it gets. The second option, short-term medical plans. So these are designed to bridge the gap between the loss of coverage and becoming eligible to jump into another employer plan or an ACA plan, for example. So 1 month at a time, 3 months at a time was the original use case for these. However, because the options for individuals has become somewhat limited and may not be the best fit for everybody, like on the ACA marketplace. These plans have been reconfigured in some instances to be up to a year at a time, up to 3 years at a time. So it acts, feels, walks, talks kind of like normal health insurance. And you can enroll in this year round. You don't have to wait for an enrollment period to do so. These plans are underwritten, so you'll have to answer some health questions. It's not the most rigorous set of questions, but if you're relatively healthy, you won't have a problem. So this is kind of like the old school individual health insurance before the Affordable Care Act was implemented in the early 2010s. This was where you went to get individual health insurance. So some good things about these plans. There's usually a national PPO network, and a lot of people really like that. And that can be a good thing if you want some flexibility, if you travel a lot and you get routine care in different places, or you just want more flexibility as far as where to go get care. Pre-existing conditions are generally not covered with these plans. In some cases, if you buy the longer term plans, they will waive the pre-existing condition limitation after the first year. So that's a good thing. Couple other things to be cognizant of here. These plans will have a benefit maximum per term, which usually is like per year. I see 1 million, 2 million as the maximum on the plans that I like within this market. So that's a lot, but if you are diagnosed with something serious or you're undergoing a lot of treatment for something, you can very easily get beyond that 2 million mark, in which case an ACA plan is probably the better fit for you. And if you develop something while you're on one of these plans where your expenses really start to rack up, then you can always jump into an ACA marketplace plan during the upcoming enrollment period. So there's a little bit of a hedge against that risk. Preventive care is in many cases not going to be covered, so you're just going to pay full price, which frankly, if you're on a higher deductible health plan from an employer or you're coming from that, it's going to be pretty much the same cost for that kind of thing. So for an office visit, I should say. So not too big of a deal. These are not ACA compliant, which is not any penalty to you explicitly, but just be aware if you have a life change or something like that and it doesn't quite fit the ACA marketplace definition of a life change, your options to jump in mid-year may be limited. So this is best for people, again, who don't qualify for subsidy, so your income is higher than that threshold, and you're relatively healthy. You don't have to be like the image of health, but you just want something that is cheaper for health insurance and still have some form of coverage. I get a lot of questions about, people in this position, like, I just want catastrophic coverage. I don't need something super whiz bang, super comprehensive. Well, this is your option. The third option is medical cost sharing. So this is the least expensive in most cases of any of these three options. It is not health insurance, but if you're comfortable with this approach, it can be great. So basically the way this works is, again, it's not health insurance. It is not regulated as health insurance. They do not use terms like deductible, out-of-pocket maximum, copay, co-insurance, but it is structured similarly. So you'll get the gist if you do a little bit of reading up on how these different services administer their plans and what it's like to be a member, because you join it as a member. And the idea is that everyone else who is a member pays in a monthly amount, a subscription fee, for example, and there's an implicit agreement to share in the cost of each other's medical expenses. Now, the company or the administrator will take care of processing everything, but just kind of the structure is that it's a bunch of members helping each other out, if you will. It's kind of an inelegant way to put it, but that's the way I think of it most clearly. Preventive care is not going to be covered. You're going to be paying out of pocket for pretty much everything as a cash patient, which in many cases can be less expensive than you think. There are some companies out there that do this very well, some that do not have such a good track record. So be very careful with who you go with. There are a couple in mind that I trust and that I would recommend to somebody. I would feel comfortable if somebody enrolled in it on my recommendation. So if you are really healthy and, perhaps you're one of those people who just is tired of the system, in which case I don't blame you, then this can be great. And there are a lot of people on this who are very happy, who've had it for 5, 10 plus years. So here's a quick cost comparison. I tried to make this as apples to apples as possible. So 2 examples. We'll go through a small family and then a single person. So I've got on here right now a 40-year-old couple with a 5-year-old child, just kind of a middle of the road example here. On an ACA marketplace plan with a $7,500 deductible, which it's not the cheapest, it's not the most expensive. It's, again, middle of the road. It's about $1,400 a month for that coverage for 3 people, not subsidized. Again, just to get the raw costs here on display. Short-term medical with a $7,500 deductible. So again, trying to get it as close as possible to the ACA is kind of the benchmark here. That cost is just shy of $900 a month. So a big savings there. Medical cost sharing is even less expensive. Let's go to the second example of a single person, to say a 40-year-old male, no dependents. The same ACA marketplace plan, the very same one that I looked up, $7,500 deductible, $525 a month. Short-term medical is about $374. Medical cost sharing, $249. So thought it'd be helpful to give some numbers to the ideas here. So let's recap which option might be right for you. An ACA marketplace plan, that's if you use a lot of healthcare, if you are undergoing treatment for something, if your medications are expensive, and certainly if you qualify for subsidies to bring the monthly cost down, the ACA marketplace is a no-brainer. Within that, you're going to want to make sure that you choose a plan from a company that has the widest network possible, or at least the ones that have your doctors in the network. That's the most important consideration once you know you're going to make your choice within the ACA marketplace. Short-term medical, if you're healthy, if you want a lower cost for your plan and you don't get subsidies, that's usually when this becomes a really attractive option. Again, this is for relatively healthy people, not the absolute healthiest people in the world, but if you just understand, hey, I'm going to be paying out of pocket, albeit at a reduced cost, but out of pocket for pretty much everything throughout the year, unless something really expensive happens, then this is a great option. The monthly premiums are considerably lower. And in many cases, it's worth the trade-offs. Medical cost sharing is just that comparison between ACA and short-term medical just cranked up a little bit. If you're comfortable without health insurance, by regulation, health insurance, but a similar structure that is outside the system, then it's a great option. Frankly, it's becoming more and more attractive, especially for people who don't get employer-based health insurance every year. So here is how I can help you if you do want the help of someone like me. Doesn't cost anything to get my help. I am paid a commission if you purchase a plan through me. That doesn't increase your cost for it. It's simply a marketing expense for the insurance company or medical cost sharing service. So here's how I like to work with new clients. First is an appointment. I meet by phone, by video call, or if you're local to me in the metro Atlanta area, in my office. But we'll go through your needs. Hey, what's your situation? What are you thinking about? What's your appetite for, a budget? Are you okay with one of these options, a couple of these options? What are your prescriptions? Who are your doctors? What are your needs like? Then I'll take that away and do research. I'll look at all the options available. I'll do that with you on the appointment if it's that cut and dry, but if I need to break away once we're done, I'll do a little bit more research to make sure that, hey, here are all the options that I would recommend that you choose from if I were in your position. And here's what they look like they would cost. And that's my recommendation I provide to you. And then from there, if you want to move forward and enroll in one of those options, then I handle as much of the enrollment process as possible. There's still some things that you will need to do, like sign off on things, consent to some things from the insurance company or the marketplace, but I set everything up. So that is an overview of everything. If you want to get help, finding a plan and going into this in depth as it applies to you, get in touch with me. You can click the link in the description here, and that will take you to an appointment with me. Thanks so much.